Welcome to the Global Plasma Summit. I'm Paul Rosenthal. I've been the PPTA General Counsel since the inception of the association in 1992. I had the experience and fun of working with Jan Bolt for over 25 years. And as someone who knew and respected Otto Schwartz immensely, I can tell you that Jan is a much deserving recipient of the award named for Dr. Schwartz. And having worked with Jan's predecessor, Bob Riley, who had the vision to create the association, I'm delighted that David Bell is receiving the Bob Riley Award. Dave has been a great leader and a great member of the board for many years. Obviously, the industry has changed a great deal since the days of Bob Riley and Otto Schwartz. One thing that hasn't changed is the abundance of challenges that the industry and the association faces. In addition to the persistent issues of plasma supply, the blood directive and reimbursement issues, the COVID pandemic, border issues, and drug pricing have come to the fore in recent months. While it would be preferable to be discussing these issues in person, we have no choice but to do it virtually. But the good news is we have a great lineup of leaders and experts to discuss these crucial issues. And first and foremost, we have PPTA President Amy Efantis. Amy?
Hey, Paul. It's great to be with you today, and thank you for kicking us off. I like to think of this as our fireside chat, but we have no fire, so we'll just call it our space heater chat. I turned up my space heater. I'm sitting in the attic of my house.
Well, Amy, I can't imagine that when you took on this job, you or anyone else could have imagined the issues that are on your plate. So what have been the biggest challenges that PPTA has faced in the last year or so, and certainly since you become the president?
Thanks, Paul. Well, I think, first I'd like to say it's great to be here. And obviously we all wish we could be together in person, but I think we're still working through the pandemic, trying to be flexible about it. But we have, such a great program, and you outlined some of it already with the awards that we're going to hear about today, the really engaging panel discussions on the blood directive, on increasing plasma availability in the UK, Canada, and Poland. We're going to hear about a panel on pathogen safety, on donor adverse events. We're going to hear about Latin America and access challenges for patients there. And then we'll look at things like IG challenges for patients during the pandemic. And we're going to hear a lot about our awareness efforts, particularly our Defy the Odds campaign, which will follow this session, which I'm really excited about. So it's a great couple of days. But the year, despite the fact that I think all of us, when we talk about what challenges have we faced, the first thing we think about is obviously the pandemic. There are, the world continues to turn. So for a number of years, we've worked, our team in Europe particularly has worked really hard on the rethinking the blood directive in Europe. So the European Commission is in process for that, but this year that work became particularly acute. So we've been involved in comment submission, reviews of drafts, a lot of education effort, a negotiation, but throughout that whole process, our focus has really been on collecting more plasma in Europe, which of course is, we have an entire session devoted to that this week. We're going to talk, I think the pandemic has meant that last year in 2020, we saw a 20% decline in plasma collection. And we'd hoped this year to see a more robust recovery. And that hasn't happened to the extent that we had hoped for. But our companies have opened a lot more plasma centers. And I think that it's trending upward, that recovery. But of course, then we had the issue with Customs and Border Protection issuing a sort of clarification of their rules that kind of derailed that progress. And that was sort of a shock to us in June of this year when the policy that they clarified said that donors from Mexico traveling on B1 visas can no longer cross the border to donate plasma because Customs and Border Protection deems them to be employees violating their visa status. So we disagree with that vehemently. But I think our greater concern in all that is not the policy itself, but was that the decision was made or seems to have been made without consideration for the public health implications. And then lastly, I would say, we've spent about the whole year really on a new strategy and structure for PPTA. And our goal in that effort is to be more focused and more efficient, more member-driven. So in that effort, we've clarified our mission statement. We're refined and narrowed our scope, streamlined our priorities. But in all of that, we've also tried to widen our global outlook to meet the needs of the future. So it's been a busy year.
So it has. But let's talk a little bit more about the blood directive. What are the PPTA's goals and where is the blood directive going?
So the interesting thing about, I think the commission and the blood directive is meant to be just that it provides direction for, of course, for countries to operate. So it's not, an edict, but it's a really important guidance document. And our focus has been on the importance of collecting more plasma in Europe to meet the clinical need of patients, which is increasing. And we see that around the world, and that's because, there's improvement in diagnoses, because we know that there's more or increasing uses for certain medicines. So I think as we've gone through this process, emphasizing the important role that the private sector has to play has been a big part of what we've done over the past decade. If you look at the growth in plasma collection in Europe to meet patient clinical need, it's been driven in large part by the private sector. I think our critics have long asserted that the private sector, that the coexistence of the public and private sectors is incompatible. But in fact, it's really the only way forward. It's the only way that we're going to meet the growing need of patients. And one of the concerns that often comes up in that discussion is that, well, if the private sector is collecting plasma, we're going to see crowding out of blood donors. But the data from studies conducted in Europe and the US show that that phenomena does not happen because, in fact, they draw from different donor pools. So I think we really need to work together, and the private sector has a lot to offer in terms of how to build plasmapheresis infrastructure on decades of safety. And that cooperation is going to get us a lot further in serving the needs of patients, obviously. And then differentiation, so differentiating between kind of whole blood for transfusion and plasma for manufacturing of plasma-derived medicinal products. That's been an important focus for us too, because we really need those clarifying definitions that will ensure better outcomes for patients. And right now, within a lot of the frameworks, those that differentiation and those definitions don't exist. So that's been a big part of our focus. And excitingly, we have a panel discussion on this very topic on Wednesday that'll dive a lot more into these details. But in all of it, I think raising awareness about the need for plasma is really where we're really trying to keep our eye on that goal. And if you don't mind, Paul, I'd love to share a video with you that we produced that really gets to this the spirit of what we're trying to do there in collecting more plasma in Europe. And I think this is such a great way to communicate these messages to people as kind of narratively.
I'm looking forward to seeing it. Let's roll the video.
All right. So I think that tells the story beautifully. And really, we cannot take our eye off the ball on raising awareness with policymakers and potential donors about the importance of donation to meet that clinical need for patients.
Well, Amy, speaking of collecting plasma, we know that plasma donations have declined worldwide during the pandemic. But since more than 60% of the world's plasma is collected in the United States, I'm sure you're concerned about those declines. Tell us about that concern.
Yeah, absolutely. So that 20% decline in 2020 was, of course, jarring. And we know why that is. I think in spite of the fact that the Department of Homeland Security deemed plasma centers essential, plasma center employees essential workers, and donors to be essential, people still had a fear of going out. Once vaccinations were available, we saw, that returns improved, but we're still in the pandemic, right? So centers are taking precautions to protect donors, respecting all national, whether it's EMA, national or FDA requirements to protect donors with social distancing, with masking, temperature taking, all the necessary screenings, et cetera. But again, we haven't seen the rebound necessary to continue to meet that clinical need. The recovery in Europe has been better, actually, but there was a smaller delta that had to be closed. And recovery in the US is not what we would like to have seen to return to those, pre-pandemic numbers. We had seen over the course of about 10 years, a very steady increase in donations year over year until we got to 2020 and saw that decline. But I think, companies are doing everything they can to try to close that gap. And we're at more than 1,000 plasma centers now, which is pretty impressive. So what we've really seen in terms of the recovery is probably more attributable to the opening of new centers than recovering all those pre-pandemic donors. So we still have a ways to go. But you can see why the issue with that arose in June then with Customs and Border Protection really threw us for a loop. So we know that there are plasma centers along the U.S.-Mexico border that have existed for a long time, and the communities on the border, in spite of the border itself, tend to be very fluid. And folks in some of those centers have had donors coming for 30 years. They live within the legal catchment area of that have been established in regulations, and they've crossed the border legally on their visas. And while they're in the U.S., they visit their families, they, shop at Trader Joe's, and donate plasma to help U.S. patients. And these are great donors who have to pass all the screenings, just like, every donor does. And we need them, especially now. So the assertion by Customs and Border Protection is that donors from Mexico were using visas to earn wages in the U.S. But in fact, there's a precedent demonstrating exactly the opposite of that. There have been cases related to the Americans with Disabilities Act where federal judges have ruled that plasma centers are in fact service providers, and therefore donors can't also be considered plasma center employees. So we're looking for solutions that would satisfy all parties. We think that there is a way to solve this that continues to obviously honor the concerns of Customs and Border Protection, but that allows these great donors to continue to help patients in the U.S. I would like to note that the Department of Health and Human Services, especially the Assistant Secretary of Health, Admiral Levine, has been helpful to us because I think HHS really understands the public health implication, what this means, and they're concerned about that. So, but in the meantime, PPTA has, engaged with policymakers in the U.S. about this at many different levels, and we've engaged in our own really ambitious effort to raise awareness to attract donors, particularly non-traditional donors, plasma donors. And we call that campaign Defy the Odds, referring to, what plasma and plasma therapies mean for those patients. It's being piloted in 5 states. It includes a number of really poignant messages. And following this session, Paul, there will be one that talks specifically about that campaign, but using social media, traditional media, and really telling stories from the perspective of donors and patients, from those who are touched most closely by the diseases treated by plasma protein therapies. So maybe if I think you liked the first video, right, Paul?
I did.
Good. So if you don't mind, I'd really like to share another one with you. This one's really personal. It features a woman named Amber, who's this amazing plasma donor. She's also a teacher, and she's someone I relate to because early in my career, I was a high school teacher. I spent a lot of years as a plasma donor, and I find Amber's story very compelling, but it's probably better to hear this from her. So let's hear the video from Amber.
My name is Amber, and I am a teacher. I started donating plasma about 2 weeks after I lost my mom. My mom has always been my rock. The plasma treatments were to help her body fight the autoimmune disease. Initially, it was 3 rounds that they called for, and then finally they did 10 plasma treatments. The left side of her brain was fully compromised, and the right side of her brain was largely compromised. So we knew all of that going into the treatment, but we still remained hopeful. Her body was responding to some degree. and it was helping. I've given blood before, but I know that it was plasma that gave me a lot of hope. And I thought, why not do something to give back? Why not find purpose in her loss? When I went in to donate, I said, so my mom received plasma treatments. She received 10 of them. If I give 10 times, does that replace what she received? And she said, well, honey, she called me honey. Actually, it's well over 160 some. I can't remember the exact number. At first it was daunting, and then I thought, no, okay, we can readjust 10. Maybe if we hit 10, then maybe I can give 100. And now I'm over my 100th give. Now I'm at 104 gives. When I give, a lot of times it's my personal time. It's my time with my mom. It is a bit of a healing for me. I've learned a lot about plasma, but yeah, I still think there's so much more to know about plasma. I didn't realize that the plasma is the part where the antibodies are, and I didn't realize that we can't synthetically produce it, so we rely on people to give. I think it's a resource that we all have that we can contribute to others and pay it forward. Walking away and knowing that you helped give somebody an opportunity for a normal life, I would say that's a very small price to pay. If you know about buckets, we all have buckets, right? So when you give to somebody, your bucket gets full too.
Wow, that was quite inspirational. Thanks for sharing that, Amy. Now, we only have a few minutes left, but before this session, we asked participants in the program to submit questions ahead of our discussion. I've got a few, if you don't mind, in our remaining time to pose to you, Amy. The first is, how is the industry helping to improve the cost effectiveness of plasma-derived treatments to facilitate the access to therapies in Europe, such as augmentation therapy to treat alpha-1 antitrypsin deficiency?
Yeah, it's a great question. It's an important question. I think if you look at some of the work that PPTA has sponsored and has done in concert with researchers, you'll see a body of work that shows our keen interest in these issues. One that comes to the top of my head is the paper that was published in PLOS early in the year by Esther de Vries and Philippe van Wilder, that really focuses on the use. This is focused on CVID, but the use of IG and a look at value, which is really important. But I think broader into this question, we've published, Ventura published a paper on the key economic value considerations of plasma-derived medicinal products in Europe. And that really looks at the important contributions of these therapies. And I think to the point of this question is really demonstrating for policymakers and decision makers the value of these medicines and the importance of it to the patient community. And then finally, I think more broadly, again, I think when you look at some of the work that's come out this year that's talked about things that we disagree with regarding, for example, the use of IG, that we should really, the essence of some of this work is that we should just use less IG. And I think that's an absurd assertion for patients. And so we've gathered an advisory group of clinicians from around Europe to really think about this issue and think about bringing their expertise together to talk about what the real needs of patients are and what we should be doing to address those needs.
Very good. I know you touched on this topic earlier, but we have a question here, which will give you an opportunity to expand on your previous discussion, which is what is being done to increase plasma collection in Europe? I know that's a high priority.
Mm-hmm. Well, Yeah, and it is, and it should be. It's, I think as I said, our work on the blood directive, providing definitions for those frameworks that make sense. These are the things that you're like, oh, that's so in the weeds and how boring. But these are the really important things that need to happen if you're only going to consider something, every, we're talking in terms of decades, we have to get it right the first time. So encouraging regulations that foster coexistence, expanding the plasmapheresis infrastructure in Europe, and raising awareness with people so they understand the importance of donation, and then for policymakers to understand why we need the kind of environment that will foster greater collection numbers. I think we've seen strides in the private sector, and that trend needs to continue so that we can meet the needs of patients. And I think dismissing those assertions of things like crowding out and instead looking to work together between public and private sector, and really focusing on how coexistence, there's mutual benefit for donors and for patients.
The third question that I've got really also relates to something you touched upon earlier about drug negotiations. And for people's background, the Biden administration's so-called social infrastructure bill, the Build Back Better initiative, has, depending on the day, anywhere from $1.75 to $3 trillion worth of spending. Mm-hmm. And in order to satisfy folks who don't want to increase the deficit, there's a lot of pressure being put on to raise revenue somehow. And among those proposals to raise revenues is effectively proposals to save money on prescription drugs and lower pricing to the federal government, if you will. Mm-hmm. Will plasma-derived therapies be swept into this proposed drug pricing negotiation?
The short answer is we're working to make sure they are not. And there's an important reason why. It's not because, we think we should just be excluded, and there's very good reasons for why we should be excluded. But I think you said saving money for the government. Of course, that's very important. I think when we look at overall healthcare spending in the U.S., I believe that the reason there is such a focus on drug pricing is, even though it's a fraction of the overall healthcare spend, because of the way our system is structured, people pay out of pocket, and so they have for drugs, and so they have a more acute awareness, and it does affect people. But it's not all drugs. I think most of us, and I heard an interview with Andrew Yang, who was a former candidate for president in the US during the last elections. I heard in a podcast with him yesterday, and this was one of the first issues that he brought up as something that's universal to both parties. And while that I think is true, it is an important issue. If you ask most people, most of in the US, their coverage is good for their pharmaceuticals. And if it's not, there's great assistance programs available. But there are a few drugs, and this is what I think the purpose of the legislation is, to go after those medicines that have heavy use, heavy cost increases. But that's not what plasma-derived therapies are in the US. It's not at all. In fact, and the one thing that really differentiates these medicines is that the cost of the raw material for plasma-derived therapies is over 60%, which, I mean, far overshadows what it is in traditional pharma. For pill and tablet, it's really a much smaller percentage, and even biologics. I mean, nothing comes close to what the cost of the raw material is for plasma-derived therapies. And then if you look at, there was a paper published a number of years ago, Bates White, that looked at a lot of the value, looked at value of plasma-derived therapies in the U.S. But you'll see that there is a level pricing over time compared to other pharmaceuticals that have radical increases. You don't see that in these medicines. So we do see in the Build Back Better bill, there's already carve-outs for small biotechs, et cetera. So certainly there should be consideration for these sort of ultra-rare communities. And I think we're working hard to make sure that there's an awareness about what it means for the patients and why these drugs are different.
Amy, that's very helpful. And I think everyone who cares about what's happening in the US appreciates that. We're out of time. You obviously cannot see the standing ovation that's being provided you right now, but as a Wisconsin native, I want to just tip my little cheese head to you and thank you for framing the issues for today and for the future. And I'll turn it back to the producers of the show and look forward to the rest of a very interesting program today. Thank you.
Thank you. Thanks, Paul.